Hey, I'm Dr. Michael Howard. I'm a shoulder and upper extremity expert here at Plano Orthopedics and Sports Medicine. I often get patients coming in and asking me about labral injuries. It's a fairly common injury that we see in athletics as well as life. Often patients will complain of pain or have some sort of injury and their shoulder's hurting and they don't know where to go. That's when you turn to the orthopedic surgeon and you'll come into our office for an evaluation. We're checking for certain things with labral injuries, often range of motion, whether you feel feelings of the shoulder being loose or lack of range of motion. These are typically associated with some degree of chronicity, meaning like it's been going on for some period of time. Workup is fairly straightforward for these. We'll start with x-rays and a physical exam. And at that point, we often determine whether we need to start physical therapy or whether we need advanced imaging, such as an MRI. When we have patients come back and evaluate them further, we're always assessing to see what their symptoms are after we've initiated treatment, or we'll review the MRI with them and discuss what the findings were. In the case of a labral injury, we're looking at the tissue that surrounds the socket. It actually acts as a very important insertion site for the ligaments that help stabilize the shoulder in a static way. Unlike muscles, which are dynamic, the ligaments actually tension up and perform a special function independent of the muscle tissue. When those structures are damaged, patients can have a problem, and that usually results in symptoms of pain or the shoulder feels loose. Typical examples are patients that were in traumatic injuries in which they felt the shoulder dislocated and they had to present to another doctor to have it relocated, or they just have persistent pain and feelings of looseness after the event. When we see these type of injuries, we're going to initiate a specific protocol and program that helps you get better. By the time they come to my office, often we will talk to them about rehab situations, although sometimes we need to talk about surgery. When we discuss rehabilitation, we're typically going to send you to physical therapy and have you follow a very specialized program that helps restore stability to the shoulder through the dynamic action and allows that tissue to heal. We'll follow up with you in increments, usually in 2 to 4 or 6-week cycles, and based on how that patient's doing, hopefully they have a full recovery and go on to lead a normal, healthy, natural life with that shoulder. If they don't have success with rehab, or we find a problem that's too severe to overcome with physical therapy, we might talk to you about surgical options. I have a long discussion with my patients about options of how to fix it. Typically, this is an arthroscopic procedure in which we restore the balance of the tissue through anchors and sutures. After we're done, we expect the patient to have a full recovery of range of motion, strength, and stability, and go on to lead a normal and healthy life. Other times we will talk about more advanced procedures in which we require using bone grafts or other techniques to restore the stability, but still with the expectation of that we have an excellent recovery and can return to sports, life, and activities as normal. I hope you found this information helpful, and if you have a shoulder problem, we'd love to take care of you and see you at Plano Orthopedics. Thank you.